Hi, so my research is on the stigma surrounding mental health among college-age students. So stigma. What is it and why is it bad? Stigma is a mark of disgrace associated with a particular circumstance, quality, or person. And there has always been a stigma surrounding mental illness, and this can have a detrimental effect on one's decision to seek treatment. My question, however, is, has the stigma associated with mental health decreased on a college campus? And if so, what were the factors that contributed to this shift in attitudes? So for me, after being on a college campus for 2 years, I've heard many of my peers discuss openly about their mental illness and about the medications they're prescribed for it. And when I talk to my friends at other universities, they've had the same experience. So just from my own observation, I think that there has been an apparent shift, at least among college-age students, who are much more open to talking about mental health and taking medication for it as previous generations were. So I want to research that. So my methods would be a preliminary survey sent to every student enrolled in a college or university, asking whether they take any medications for their mental health. If respondents answer yes, there would be a follow-up question, asking for what these medications are prescribed for: depression, anxiety, schizophrenia, OCD, etc. This survey would ideally be taken after the first semester of a year, so freshmen would have time to make the transition from high school to college, and during their final exams, and seniors would still be working hard, whereas during second semester, they might not put themselves in stressful positions. This survey would present a current estimation of what percentage of the student population takes medications such as Prozac or Zoloft, which can correlate to the degree of the perceived shift. A high population of students taking prescribed mental health drugs would correlate to a lower amount of stigma surrounding mental health, and a low population of students taking prescription medication for mental illness would correlate to the opposite. Next, the student population who responded yes to taking prescription medication for mental illness would be given a second survey. Questions on the survey would ask about what prompted them to seek treatment. Did they face any sort of rejection or ostracization from friends or peers? Had they been previously educated on mental illness, such as depression, as well as their treatments? And from what sources? Media, friends, direct-to-consumer advertising, teachers, etc. The answer choices to the survey would consist of a scale ranging from 1 to 5, 5 being, this factor strongly contributed to my awareness of mental health, and 1 being, it did not contribute at all. Next, a survey would be given to students on college campuses who are not taking any medication for their mental health. And this survey would ask questions about their opinions on mental illness, where they've been exposed to discussions on mental health and illness, if they know anyone on medication to combat mental illnesses, etc. To analyze survey responses, the data obtained from the scaled questions would be coded, and the average of responses for each particular contributing factor would be taken, the highest possible average being a 5. From this, the factors that encouraged a change in attitudes towards mental health become evident and can be ranked according to their strength. Such factors include outlets such as the media and the people in a student's immediate social network, such as parents or teachers. And it's also anticipated that there will, in fact, be a shift in attitudes. In my mind, I think that we have a pretty high population of students in America who are on drugs for a mental illness. What other related research says? So, research has said that direct-to-consumer advertising has no significant effect on the reduction of mental health stigma. This is important because this was one of the reasons DTCA was legalized in America, America being one of 2 countries who allowed direct-to-consumer advertising for medications. However, this has been disproven, so that should be taken into consideration the next time talk about DTCA comes up. Next, stigma surrounding mental health can introduce bias. So studies have shown that employers are often, whether subconsciously or not, they're often biased against hiring people who do have a mental health history, which is obviously detrimental to success in life. And, as I mentioned earlier, the choice to seek treatment for mental illness, which is, in fact, an illness just like a broken leg or cancer or anything like that, is also impacted by the stigma surrounding it. So people are not getting the treatment that they need to be as healthy as possible. And the importance of this research. There are important sociological implications in regard to patient autonomy, discrimination and bias, and medicalization pertaining to the definition of disease itself. This can also lead to further research pertaining to mental health on college campuses and what can be put in place to reduce the stressful factors that may contribute to the high percentage of students who are using drugs such as Zoloft and Prozac. Yeah.